Hi, my name is Mara Lucato. I'm from a small mining community known as Kirkland Lake, Ontario. I love and am very proud of being from that community, largely because they're good people. I worked in a very fast-paced lifestyle where I worked in reproductive endocrinology. I was running 5Ks a week, sometimes 2 10s. I did yoga once a day, if not twice a day. It was amazing. And I had lots of strength. I was very proud of my physicality. I was proud of my intelligence. I was proud of the eloquence with which I would speak to people and convey really high-level information on behalf of patients. Unfortunately, that all got ripped away from me. You wake up one morning and you don't remember where you are. You can't go running anymore. You can't do yoga. And then I started getting bouts of what I thought was cellulitis, or so they thought. And it all came to a head in, I think, May of 2020, where one day I had a little spot on my hand and a couple others on my face, and then on my skin started to fall off. Literally. I'd had 3 what they referred to as transient ischemic attacks, were like mini strokes, and where I lost the sensation down one side of my body, and then I had another and it was the other side of my body, and I remember slurring my words, and the last one I had difficulty walking and talking. And I lost my orientation completely. And so I was in a really dark place. I lost the ability to walk. I lost the ability to talk. And more importantly, access to everything in my brain. There were no answers. I was on all kinds of medication. Nothing was helping. The pain, the frustration, the futility, I just wasn't getting any attention. So I'm like, there's nothing else to do. And in walks my mother, Doreen. My mom's 81 years old. She's been working in parallel with Envita since its inception, actually. She met Dino Prado probably 20 years ago. So I just Googled it and I just checked out the website and I thought, you know what, it's worth a try. So I picked up the phone and I was put through to Marissa. And we had a wonderful chat. It was like talking to an old girlfriend. I felt validated. It just felt so good. Like I'm not crazy. And she had me booked in for June. So literally I called her, I believe in May. I was scheduled for June. I told my family. And then I went to my family doctor. And he said, Mara, go. You're doing the right thing. And he was the first physician who was actually honest with me and said, you know, you need to go. Go. So I did. And I gotta say, wow. You know, from the moment I walked through the door, I felt like this weight come off my shoulders. It was like, they get it. I met Dr. Coffin. And, you know, he was never impatient. He was always clear. He always had a very good plan. And I felt safe. I felt validated. It was Felicia and it was Rachel. And those were our nurses. And they were so important. And I thought I knew just about all I needed to know about healthcare. And I'm so grateful because they integrated so many things and took such good care of me. It was all about caring for the individual, both physically and mentally. So IRAD, I think, is insulin-resistant antibiotic delivery. And I mentioned earlier that I had neurological Lyme. So my disease state manifested in my head, my heart, and my skin, which is the largest organ in your body. Lyme's intelligent in that it can hide, and the brain is a very good place to hide. I was so excited because I knew that the Lyme was in my head, and in order to attack that. We had to break what they call the blood-brain barrier. And the only way to do that is through IRAD. Now, my exercise, I'm climbing Pinnacle Peak because there has to be purpose. And so I'm combining living with good health. And it's so much more rewarding and productive. So I encourage everyone to do that. And I could feel myself getting stronger every day. They have a specific toolkit. I'm happy to say they individualize the care across the board. And they look at all things that are ailing you. And, they'll bring in conventional medicine when they need it. But, their focus is to combine that and heal the soul, the heart, the head, and the overall health status of the patient so that they can continue to thrive once they beat this.